Migraine, it is a neurovascular pathology in the central nervous system. The pain appears at adolescence near the age of 30 years, more prevalent in the females as compared to males. It is a unilateral and throbbing and pulsatile in nature. It is a disabling one. It produces trouble and disturbance in the normal lifestyle and the activity of the patient. Pathophysiology is there is genetic and familial predisposition in which there is abnormal genes. The pain center produces abnormal electrical voltage or the impulses and the waves that travels through the pain receptors which are present in the extracranial vessels, meninges, scalp, trigeminal nerve fibers, brainstem, and then spread to the face muscles around the eyes and the paranasal sinuses. And they produce the episodic pain, which is very severe one, and it is a very troublesome to the patient. So the other factors, in addition to the familial predisposition, they are the stress factor, physical as well as the psychological and neurological stress, that is depression, anxiety, that also act as the trigger factors. Diet which is rich in red meat, red wine, chocolate, caffeine, alcohol, that also play part or contribute in the production of the migraine headache. So it is a headache which may appear in episodes after several months or several days according to the severity of the and the stages of the disease. Hormones, especially it is more prevalent in the females, so the estrogen hormone play a vital role for the production of this unilateral headache, especially before menstrual and menstrual period, and it fades away or gradually diminish after the menopause when the level of the estrogen in the blood is reduced. Diet factor and also seasonal factor, these all factors they are included in environmental factors. So mood changes, depression, anxiety, irritations, they also activate or act as the trigger factors for the production of this migraine pain. Dehydration, if the patient is dehydrated, doesn't take sufficient quantity of pure water, that also contribute in the production of this disease. Other factors, that is flashes of light, loud noise, strong odor or the perfumes, they also act as the trigger factors for the production of the migraine pain. There are 4 phases of migraine pain. First is prodrome. Prior to the actual headache, in this there is constipation, irritation, frequent micturition. So these are the various depression. Next is the aura. This period lasts from few minutes to up to 1 hour at the most. During this period, there is disturbance in the visual field. There is blurring of the vision, may be transient loss of vision for a short while. So in this period there is photophobia and sonophobia. There is giddiness, vertigo, tinnitus. These are also the symptoms which are produced during this phase. The main point in this phase is disturbance in the visual field. Next is the actual phase, that is migraine headache period. In this, there is severe, moderate to severe pain, which is unilateral, throbbing, pulsatile one, and it lasts from 4 hours to 72 hours. This is the typical diagnostic feature of this phase. There is paresthesia, that is tingling and numbness. There is photophobia, sonophobia, sensitivity to the light, flashes of light, and also strong perfumes, odor. They also stimulate the act as the trigger factor. And the last one is the post-drome, that is after the period of the migraine head is over. During this period, the patient is exhausted, frustrated, irritated, and there is neck stiffness. So these are the various phases of the migraine and the various causes. Mostly it is a genetic one, unilateral one, and more prevalent in the female gender.